I'm Dr. Miguel Perales. I'm a stem cell transplant at Memorial Sloan Kettering in New York, where I serve as Deputy Chief of the Adult BMT Service, as well as Director of the Adult BMT Fellowship. I'm also a member of the Committee of Education of the ASBMT, as well as the Committee on Practice Guidelines. So the question is, what are the primary benefits of using the Clinical Case Forum for members? I think there's several benefits. Number one, it allows us to have a broader access to experts beyond our own center to discuss complicated cases. And so that therefore can help improve patient care at our own centers. Number two, for experts, I think gives us an opportunity to participate in discussion as a group and to provide our expert opinion in certain cases where we can not just benefit one patient directly in a one-on-one discussion, but we can potentially also benefit other patients by having a discussion that's open within the community. And number three, I think importantly, is that by working together as a group, we can all learn together from these discussions. We can also imagine that some of these discussions may lead to collaborations between different members of the community. We could, for example, identify unmet needs, develop potential clinical trials or other types of collaborations. And we also think that this can also be an important educational tool for the community, particularly for trainees such as fellows, as well as mid-level providers and even junior faculty. The forum, when you log into it, has several features that are interesting. Number one, there's a listing of the cases. You can see which cases are the ones that are most recently posted. You can also see which cases have had recent comments. And so you can immediately direct your attention to those cases or to those comments. You can also see the cases that have active discussions. One of the features that I particularly like is the ability to also include data in the case, either imaging or other data. And typically when you'll consult a colleague by email, you'll usually just write an email. It's rare that you would include an attachment with that email. But the forum has the ability to handle images as well. And so in the context of the chronic GVHD cases that have been discussed to date, people have often included images of skin lesions and so forth, which can be very helpful. One of the cases that I posted was a patient with Hodgkin's lymphoma after an allogeneic stem cell transplant. She was on a calcineurin inhibitor and then developed a syndrome called PRESS. And that particular clinical syndrome has a very typical MRI picture. And so when I posted the case, I also included a picture of her MRI, which had sort of the typical features. And that, I think, is one of the enhancements of the clinical case form, is that we can not just review the clinical history, but also see some of the relevant imaging. Well, the fact is that it's actually very easy to use and very intuitive. Once you're a member of the community, you will receive an email notification once there's a case that's posted, and by just clicking on the link, you will immediately have access to the case that's being discussed. The site is very easy to navigate. There are features that you can easily understand in terms of responding to a particular case, posting your own cases, adding images to the case and so forth. And so I think it's really a very user-friendly site.